But we begin tonight marking the anniversary of the pandemic that has changed our lives.
It has been exactly 1 year since the first case of coronavirus was confirmed in Arizona.
It is an adult member of the ASU community.
And so much has happened since that day. Dr. Kara Christ and Governor Doug Ducey then becoming the faces of Arizona's coronavirus response. At first, our state was considered the model for how to reduce the spread. But today, Arizona is seeing some of the highest mortality rates in the entire country.
Right now, you're looking at the faces of just some of the 12,000 Arizonans who have died from COVID-19. A year ago, they had no idea they would become the victims of a global pandemic. Tonight, our Nicole Grigg is taking a deeper look into the decisions our healthcare leaders have made these past 12 months and what that can tell us about where we go from here.
Turning now to another developing story. Someone here in the Valley confirmed to have the newly identified strain of the coronavirus.
I think all of us believe more could have been done.
The scientists and the physicians have been, for the most part, correct.
It's very important for all of us to listen to science and follow science.
It was 1 year to the day when state health officials confirmed the first coronavirus case in Arizona.
They are currently isolated in their own home.
The number of cases started to grow. When you go through the timeline, a public health emergency was declared in early March. Restaurants closed a week later before Arizona's version of a stay-at-home order was put in place for 45 days.
There were moments in time where I felt like our advocacy was having an impact.
From early on, the state's former director of public health became a strong voice regarding the pandemic. Will Humble recalls when the stay-at-home order ended and we began to see a rise in cases.
What stands out to me is, it took too long to do that intervention in June, and that is partially what led to the July crisis, but also the success of that intervention. The success of closing the bars and the nightclubs and having restaurants go back to takeout service was dramatic.
As Will points out, Arizona would go on to become a model during the summer. Former President Donald Trump applauding the governor on a national platform.
He was always asking for a lot for Arizona. And
the state went on to publish its own CDC report of the success in the summer. But by fall,
I think there were times earlier on when some of our advocacy had worked. I haven't seen any evidence at all since Thanksgiving where my or anybody's advocacy has had an impact on the policy decision.
Arizona has a governor who has said repeatedly what's guiding him.
Guided by public health the entire way.
I'm going to be guided by the facts.
I'm working with the subject matter professionals.
I have incredible confidence in the Department of Health Services.
Protecting life, protecting public health first and foremost.
And these are just some of the faces of the experts that are being led by science, data, and expertise in their field.
Everybody in public health is throwing a tremendous number of man-hours at this particular problem.
Dr. Joe Gerald, an associate professor with the University of Arizona, has spent nearly an entire year working 7 days a week on models and predictions to try and help guide those like the governor and Dr. Kara Christ to make decisions.
Certainly it's encouraging to get some of the predictions correct, but if those don't actually translate into policy changes, then I'm not sure what it was worth.
Many of his reports from fall through winter have predicted the startling numbers of deaths that were to come without new, stricter mitigation measures. But those reports felt ignored when no new measures were taken.
I think I've been disappointed and frustrated that the state has not done more to reduce the impact of this outbreak on the state as a whole. I think all of us believe more could have been done and more should have been done.
Instead, we've had a governor who has vowed for months that Arizona is open.
Arizona is open. Arizona's economy is open.
I think what stands out the most is the lack of strategy and long-term planning efforts.
Wendy Smith-Reeve is the state's former emergency management director and ABC 15 analyst. She has spent 2 decades in emergency management.
We really could have been ahead of the curve on some of these actions and activities had there been proper planning.
And 1 year later, doctors like family physician Dr. Andrew Carroll still remember their first case.
My first case of COVID COVID was an asymptomatic patient, a patient who had no symptoms at all.
Dr. Carroll is now working surge shifts to try and help the hospitals that have been pleading for months for help.
You get suited up and you're all ready to go. It really does feel like you're entering a battlefield. You go in there and you get the calls overhead that there's a code blue or an emergency room emergency. And everybody's running there as quickly as they can.
And with those shifts, there is so much loss. Arizona has one of the highest mortality rates with over 800 deaths a week in December.
Most of our guidance here has been driven by commercial interests, keeping bars and keeping restaurants and keeping businesses open.
Arizona has a population similar to the population of Washington state, but has triple the amount of deaths. Arizona has around 7.2 million people and more than 12,000 deaths. Washington state with around 7.6 million and just over 4,000 deaths.
People in Seattle have seen it firsthand that this is a devastating virus, and if it spreads, it will cause a lot of deaths.
ABC 15 going one-on-one with scientists with IHME at the University of Washington, where they say our two states have seen COVID-19 differently. They saw the first outbreak and first deaths, which changed their policies.
And that impacted our behavior here in our state, and the response by our governor and our government here. They put more mandates immediately. We had a mandate for masks much faster.
And those IHME models now predicting Arizona will hit 18,000 deaths at least by May 1st.
We should be reducing the number of deaths. We should be reducing our caseloads so that patients are able to have a fighting chance of surviving this disease.
Looking back, I think one of the things that we didn't fully understand was that this virus was evolving and it was changing in a way that was making it more infectious.
Epidemiologists like Dr. David Ingenthaler have made a career tracking and sequencing viruses.
It was harder for us to try to prevent this from spreading by using the measures we were using. In fact, it may be nearly impossible to prevent the spread. What we could do maybe is a better job at protecting those that were most vulnerable.
And then there's the question, could Arizona have done more?
There's no question that many Arizonans were infected and died. Those infections deaths could have been prevented.
And Professor Gerald ends with it's because of the choices that have been made here. In Phoenix, Nicole Gregg, ABC 15, Arizona.